So the next one that we were going to discuss is digoxin. Oh, I also wanted to mention that aconiamine vitamin K is on page 991, and digoxin will be on page 523 in your Lenny's textbook. All right, so digoxin is a cardioglycoside. It says positive inotropic action increases the force of ventricular contraction, or you can define as increased myocardial contractility. It just has that ability. It makes it easy. Force, frequency, and contraction will be more like, I'm using my hand to show pumping of the heart. The half-life is 1.5 days, and it reaches those plateau levels at 6 days. But the reason you need to know this is because it has a very narrow therapeutic index. What is it? It's 0.5 to 0.8 nanograms. It's an N, not an M. Nanograms per milliliter. It's very important to know. You're supposed to administer, it can be administered orally, an IV. An IM route is considered very dangerous. So remember how IV is dangerous for, the IV is deathly for the vitamin K. Well, it happens to be that the IM should be avoided in digoxin. Okay? Also, when you administer to these patients, make sure you check their apical pulse that is 60 beats per minute. If it's changed or it's below, definitely hold that medication. When given the IV, make sure you monitor those cardiac monitoring for at least 1 to 2 hours continuously. You also want to monitor for your big keywords: blink, 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 digoxin toxicity. Yes, visual changes with the reference of halo surrounding light colors, and like you see the yellow hazy vision. But what happens if this patient is a pediatric? What do? Well, it's said is in the PowerPoint that we see nausea and vomiting in our pediatric nonverbal patients. We're gonna discontinue it and assume that's digoxin toxicity ahead of time, just for precautions, because they're not talking, so we don't know. Okay, so now we're gonna just real quickly. It's very important to know the drug and drug interactions, and the reason is because it has a lot to do with potassium a lot of times. So if you decrease potassium, you're going to be increasing digoxin in the blood. Well, if you increase digoxin in the blood, happens to be that that's a high risk of digoxin toxicity. But if you're increasing potassium, like in your ACE inhibitors, we were just talking about enalapril, you're increasing ACE inhibitors or your ARBs, guess what? You're decreasing the therapeutic effect of digoxin. So you may have to be increasing those levels because the whole dosage is based on those plasma levels of 0.5 to 0.8 nanograms. Okay? So if we're having too much potassium in the blood, we're also decreasing the effect of digoxin. Sympathomedics, like things that increase your nervous system, it can have an additive effect, but you're a risk for tachycardia, which is very dangerous. There's another one that's in the textbook that we have not learned. I don't remember learning about, but I may have learned about it. I'm just not sure. Quinidine replaces digoxin. So it replaces digoxin, so it makes it more available in the blood, but it also reduces elimination, which is very dangerous. And verapamil is calcium channel blocker, I'm pretty sure. I'm not sure, but I know it affects the heart contraction. So if it affects the heart contraction, we don't want to be counter-interacting something that's doing exactly the opposite. So that's everything you need to know about digoxin toxicity. It's avoided to take an IM. Monitor if you're using IV continuously for 1 to 2 hours. Look for that apical pulse 60 beats per minute or around that. And 0.5 to 0.8 is nanograms per milliliter is your therapeutic narrow index dose.